Now, Health Cabinet Secretary Aden Duale has issued yet another promise seeking to calm the discontentment of more than 7,400 universal health coverage staff whose employment fate remains uncertain and who have now issued a 14-day nationwide strike notice. The medics say they are yet to receive their confirmation letters under permanent and pensionable terms and are demanding absorption, failure to which all health workers across the country will down their tools in support of their colleagues. Helen Aura with more from the healthcare workers and the CS.
The ping-pong that has left universal health coverage staff clutching at straws and turning up in huge numbers demonstrating in Nairobi's central business district is likely to reawaken in the next 2 weeks. Many promises, they are yet to be absorbed and compensated in perpetuity. The Kenya Environmental Health and Public Health Practitioners Union Secretary General has warned of consequences.
All the unions represented here today, Helen, they have actually issued 14 days strike notice beginning today. So by 20th of this month, there will be no services in this country, healthcare services in this country. On
11th June, Treasury Cabinet Secretary John Badi stated that the budgetary allocation for UHC staff was increased to Kenya shillings 8.9 billion. But now their contracts come to an end. And the Kenya National Union of Medical Laboratories officers, alongside other bodies under the Health Union Caucus, accuse the government of neglect.
So why is it that at the tail end, where our colleagues have no contracts, is where now somebody comes and say, we want this money to go under DORA? Where were they all this time? It is their mistake, the Council of Governors, the governors themselves, because they have never appreciated the work that is being done by UHC.
The Council of Governors says its hands are tied as the 8.9 billion shillings allocated was put in a conditional grant as opposed to the Division of Revenue Act. Sources close to the ongoings tell NTV that Aden Duale and COG held a 2-hour consultative meeting behind closed doors last week, where governors demanded a concrete and elaborate absorption plan that guaranteed continuity.
The COG together with the Minister of Health need to have an agreement. They need to be consensus and ensure that they issue permanent pensionable letters to our colleagues. Money or no money, we want PnP letters for all the UHC workers.
Through a statement, Health Cabinet Secretary Aden Duale stated, "I wish to reaffirm and assure all universal health coverage workers that the government remains committed to the seamless transition of the UHC staff. Key milestones include the ongoing classification of funding from the county government's additional allocation framework to the Division of Revenue Act, which will facilitate the transfer of payroll responsibilities to county governments." Will this be another promise joining the queue of previous ones, or an actual one that will be fulfilled? Helen Aura, NTV.